Good afternoon. I'm Michelle Turner, Movement Lesson. I'm here to show you a different way of looking at infant developmental movement patterns, specifically evaluation techniques and definitive milestones. I'm representing a whole new sort of milestones, and what I define infants is birth to 4.5 months. This paper is actually 45 pages, and I would be more than happy to give you the information as we continue. But I'm really here for this presentation for you to start looking at a more visual, definitive way to assess infants as they start to develop. Now, as we all know, that newborns are not able to initiate, stimulate, or enhance their movements. Infants, newborns, when they are born, are responding to their environment, particularly to gravity, and to do so needing rotational movements. When there are different forces involved within their delivery, and even a full-term baby can have life experiences not meant to happen, even just being in phototherapy for a few hours, being away from a parent. What if a parent falls ill after delivery? There are so many informations that's needed. It's not just about premature birth trauma babies that they will start to have deviations within their initial movements that they're meant to have. And of course, everyone has been presenting so far that we have so many babies being born every day, but there is so little follow-up done and guidelines. Even a typical OBGYN is really delivering your child and never seeing them again. So even to look at different measures of birth modalities that are being used are not followed through only when we're looking at certain children at risk, but that population is increasing beyond the more familiars of cerebral palsy and autism. Looking at just the act of birth happening, and you can see this slowly happening here. What a crucial phase that is happening in a vaginal delivery is not only is the rotation starting to continue, there's no rotation that it's done in utero. The rotation is starting to initiate at birthing process. But also what's going on here is within the contractions or the active and passive phase within the muscle structures. And that is really starting to give the infant the information of having active and passive phase muscle structures and their ability to respond to stimuli through that rotation. So now what I'm introducing here again are a bunch of different developmental milestones or definitive milestones, but these in particular are within the movement patterns group. So as I will always go back to, because without rotation we cannot oppose gravity, and this is one of the first key things that a baby can be even evaluated, assessed for, is do they have rotational movements within all areas of their bodies. So the ability to suck, nursing, and it's obvious, but it's more introduced. People think it's more of a primitive reflex. I believe that if you can initiate and stimulate, it's not necessarily in a reflex category. Sucking really, and it's presented more thoroughly within the paper, comes with the active of, again, vaginal delivery, the fontanel openings that happen, and the palate strike of the gravity cavitation, very similar to pulling the cork off champagne in a sense, opening up the lung cavity, and where we have our breathing, our ability to breathe. And when that cavity opens up to stimulate actually internal response to muscle structures. We're more used to a system called biomechanics. That's more of a mature movement. I'm introducing more of a systems mechanics of when all these systems start falling into play within the first days of birth. And you're going to see the baby's ability to counter-respond to any stimuli and touch responses. Really a crucial thing that I really want to introduce here is the absolute horizon, which happens within really first moments, but hopefully within the first week of birth, where in a sense that counterbalance, that counteraction, counter-rotation can start to set up. And I'll be showing you the film in a second that you can see typical and atypical response to that. The ability to reach starts coming into play as they age, where they can reach really from all areas of their bodies. If you to work with an infant, as I do, you can actually feel, if you touch any rib, any vertebrae, they'll respond, they'll reach, they'll touch to you. Where we're looking more at the action at this point, I'm looking at where movement comes from within the body and their ability to expand and reach out using that counter rotation. As again they age, they'll start bringing their hands to their mouths and start working on those spatial orientations. I'll be discussing that in a sense with my subsenses. Rolling over will start to happen at the 2.5 months level. And a neutral base, they should be able to roll over to the left and to the right and equal within that neutrality of that counter action, counter rotation. This is really crucial rolling over. You'll start to see really big deviations in movements. My really largest class of clients are calling in because a parent is not there to criticize their newborn, and they don't know. And for most professionals, it's really about that they're just sleeping and how they're eating and they're gaining weight. We're really not looking at the developmental movement patterns within this period. And I get the 5-month-old baby, the 6-month-old baby, when the parent knows the child's now not rolling over and they're not even close to sitting up at that stage. And they'll start to really deviate within their movement patterns, but also they don't have that correlation with the professionals that they really do need a more strict early intervention at that point. Instead of tummy time, what's really looked at, especially when you're putting a child, presenting them on their bellies and they're just not ready to receive this information, it's actually much more. It happens at the 4.5-month level is a pubic bone strike. And this strike actually is the first indication of the pubic symphysis working and going into what I really consider as a pre-walk. Their ability to start to navigate. It's not a head lift. It's a pubic bone strike and counter responses into where they're organizing now. And they're starting to go into their absolute vertical, which comes later on. And now going into what I like to refer to or to introduce are transitional milestones, which I was talking about, that asymmetrical countering, brooding, head rotation, breathing, crossing midline, and rolling. Now, to cover that more so within this video, you'll see now he's born 40 weeks, full term, no drugs, vaginal delivery. And you can start to see the absolute horizon, the counter rotation, the response to stimuli, and how he perceives himself within space. He's 3 days old here. Whereas this little guy was born 5 weeks premature, he's missing part of his heart, 10 days NICU, etc., that he had. And you can see where he's not established his absolute horizon, rotation within the systems, even his breathing has not filled the cavity. Even though, again, he's released from the hospital in this watch and see, and we hope he's going to do okay. But I had to get him ready for open heart surgery at the age of 6 months. Really, such a missed milestone is not only the act of the transitional rooting, but nursing itself. Not only the bilateral feed, the setting up the bilateral vision, but really organ functions that happen within a twisted rotational elimination and digestion of food that happens around the chest cavity that does not introduced in bottle feed. Now, I'm not saying that if someone who's not bottle feeding it, where there's an issue, is we need to start looking at these developmental movements that are supposed to have happened, that are not happening, and to introduce them through various stimuli to help the child. So as we go into social movements, again during this period, from crying to the coo, to the tongue out, to the raspberries, but just how a child is interacting between the crying and thinking about life, just the stimuli, the act of what crying does to their system. Again, like I stated today, it's not about inhibiting their voice, but letting that exploration come in and out. Obviously not putting them into a situation where any kind of therapy or stimuli is considered work or traumatic, but at the same time allowing that development of speech at this early age. And when children aren't crying, aren't cooing, and is, again, another big warning sign that they're not going into those kind of different areas of development. When we go into sight, and this is where it's really my passion, is how vision affects development. When a baby is born, they're not meant to have that muscular ocular vision, that sight, because it helps set up where they are, that absolute horizon, that counter rotation and everything that is about to happen. Despite going on with that they are born nearsighted, going into black and white, then they can follow, see colors, see faces within that 4.5 month period. But just the fact that you will be able to, and you can watch Emrys see here, how his eyes just are responding to stimuli, how, despite how he's being touched and moved, how his eyes can rotate and just be within the horizon. Now he'll fix a little bit towards the end going into upper quadrant vision, but just that you can see, and that is about the most that you're going to start to see where muscle starts engaging. So a child that is born with strabismus and other kind of ocular deviations but have muscle-based functions involved really start to throw off spinal and leg movements, and has to be taken more seriously that it's not just delayed maturation going on at this point. So when we go into the traditional, the topical senses, obviously we all know about taste, sound, sight, and touch, smell, the 5 senses, but I really started to explore more and more that just because I taste something doesn't mean I can swallow, and just because I can smell something doesn't mean I can breathe it or swallow and breathe at the same time. And really start to see those kind of conversations, especially with those that have been in the NICU and had cesarean section. I'm finding really where it is they've been removed through the butt first delivery, which is takes away the head first rotation. And again, I go into more in detail, but I really want to bring out that we have a sense of balance. We all know this, but why is this not considered a sense? We have a sense of counterbalance. Now, what a baby does not have is counter opposition just yet. And when a child does show with counter opposition, I'll review it again at the end, that's when I'm at high risk for cerebral palsy. When you're seeing counter oppositional moves and applied force versus a weight transfer. So those are more action-based subsenses. Then you're going into succumb and oppose gravity. Well, a child that is hypotonic is succumbing to gravity. They are not going to start opposing gravity. They do not have these rotational movements. They have such a clear deviations of what I'm showing you here, but those can be stimulated that they can start feeling that opposition to gravity. Where we have momentum, we have a sense of rotation, and we have a sense of acceleration. A child cannot have fine motor skills that are deviations from their pelvic skills and sacrum skills at that immature stage. We can develop those skills, but they're not going to show up within an infant. We do have a sense of temperature, and we do have a sense of pain. And those are reactive type senses, and then obviously the proprioception and the spatial orientation, which are more the kinesthetics. And they really need to be explored more, especially when a child's traumatized, when you've got NG tubes, G tubes, they're intubated and so forth, where they're not going to have that ability to respond to those kind of stimuli. A baby that is receiving such pain with head IVs and so forth and pulse ox, you just don't understand how their systems will start to shut down because they just can't handle the overload of those senses that might start to become developing later in life versus just where they are in space. So with that, I want to just discuss some of the reflexes that we're all familiar with. Within these movements, there's a lot of discussions more of the flight or flight, but I want to go back to how an infant responds to some of these key reflexes. So with the Moro, you'll see when he's engaging his entire system around his central nervous system, and that really allows that, just that initiation. I like to use the visualization of like that starting that lawnmower, but you know, nothing's being done to harm or stimulate this child in a way where he's going to have a cognitive decision that was a flight or flight reflex. When a baby is born, they do not have articulation of the bones at that time. And these reflexes are coming into play in a sense of where they are in gravity to start having articulated spinal movements. one of the palmar here, and as you can see, again, this organization of gravity, if you notice the speed of his hands, and I'll show the feet as well, are at the same momentum. He's opposing gravity as well as playing with that. It's not about just getting someone to grasp a finger, and that's really a big false indicator for a lot of cerebral palsy, because they will have the grasp, but once they go into a load lift organization, then they stop weight transfer. And then they, in a sense, can't release, can't let go. The testing module has to be looked at a little bit differently here. And the same thing you'll see with the plantar, where the feet are going again, in and out of exploring where they are in space with that ease of movement. With the ATNR, and we can all actually do this one, probably a good stretch and so forth. The action is looked at as a fencer, but actually what they're really looking to do is, this is the first movement they can make where they're starting to deviate movements within the scapula, and it's starting to articulate the upper thorax. And you'll start to see an extent so that it's really a pre-crawl. And also what they're doing here is they're thrusting against gravity and thrusting against gravity. It's not so much that they're stuck in this position. Now, obviously, when they can't cross midline within the spinal processes, then that's where you're going to see a symmetrical ATNR, where they're not going into a bilateral motion. And yes, we do have an early indicating a warning sign, but I really want you to start seeing just the pleasure of watching movements within infants and starting to see, not that we're looking to diagnose or find something wrong with them, but to say, I think we need a little bit of assistance here, and these are movements so that we can offer parents as well as practitioners and professionals to offer the new integrations and movements. And finishing up with the STNR, but you can see too where here he's coming into where he's got a good drop within the pubic bone, and where that's starting to take place where he's going to go into pubic bone strike. So really, I just want to finish this up and start to look at that movement is crucial from the moment we are, yes, in utero, but the second we've just hit the ground running. And we do so little to appreciate this valuable time in the foundation of our lives. And really, these movements you can clearly see in 5-year-olds to 10-year-olds where they didn't crawl, and we can be more obvious with their developmental milestones that they missed, but did they miss something else? But I really want you to look at some of the kids that I work with is yes, he might have a trach and a G-tube and an NG-tube and all of these kind of things where they've gone through things or genetic conditions, but that doesn't mean that that should only be the only class of child that is open to early intervention and early responsiveness to our movements. I have a greater movement vocabulary than an infant does, and so do all of you here, and we should be able to offer that to our children. But we really need to look at it, just all children, by influencing who they are and how they can move within their first days of life. And where I'm going to go again, where you can start seeing again where Adam, you can see where he's floating, but you can see the difference in Max's way he's responding and the jerkiness. Now, Max now is 4 and he can ice skate, so, and he's had me for a long time, but it's just the quality of movement can be changed at any age. Why not start at the first day of life? And I really hope that you're starting to see just the clarity of movements that can go on within an infant within the first months of life that are just crucial to how they become later on. And it's so much easier now to influence them here than this wait and see approach that is just unfortunately far too common. Right now, as you can see, the statistics in the US, 1 in 6 are under some kind of special services for schooling. Really, it needs to be lessened, that we can't keep going and having these conversations and watching these numbers increase. Thank you very much. Again, if you have any questions, feel free to email me, and I'll be happy to answer anything now.